Welcome to Kidney Conversations with Remend. It's a webinar designed for patients by patients and where we have open, honest discussions about kidney care. I'm Kiku Boyance, and I am the Executive Director for Remend, a peer-to-peer mentoring organization that helps encourage people with kidney disease make informed decisions about their kidney health. We're a network of individuals who've experienced chronic kidney illness, dialysis, and/or kidney transplant. We offer advice and emotional support to motivate and empower those who are on their kidney journey. Visit us at remend.org to discover more about what we do and the various ways you can help support us as we support others on their kidney journey. So we're pleased to have you with us as we explore the various types of dialysis and the factors to consider when choosing the right treatment for you or your loved one. It's understandable that facing renal disease and dialysis treatment can be overwhelming, to say the least. However, it's important to remember that there are treatment options available, each tailored to fit the unique needs of patients. Dialysis is a life-sustaining treatment for individuals with kidney disease, and understanding the various types of dialysis is critical in achieving the best results. We're excited to have expert speakers today who will discuss in depth the different forms of dialysis, their benefits and challenges. So sit back, relax, and get ready to learn about the nuances of dialysis that will hopefully help you make informed decisions about your healthcare or the healthcare of your loved one. Before we begin, I'd like to ask that the people joining us, please, thank you for joining us, and please type your questions in the Q&A box. We also have a short survey after the webinar, and you can complete that anonymously. Your participation really helps us decide the content we produce and assures us that we're highlighting the topics that you want to talk about. Our panelists today are Charmaine Griffith. She's a Remend mentor. She's been with Remend since the beginning. Cindy Polis, she's a registered nurse and care management and education nurse with Balboa Nephrology. Justin Bennett, he's also a registered nurse, focusing on home therapies, transitional care with Fresenius Medical Care. So let's see, everyone. How's everybody doing today?
Good. How are you, Kiku? Thanks for doing this.
Hi, everyone.
Oh, my pleasure. Thanks for being here, everyone. Hey, Justin.
Hey.
So I just wanted to start with kind of like a breaking the ice thing. I mentioned what you all do, but I'd love if we could just kind of go around the room and let everyone know like what a typical day is like for you. What do you do for the kidney community here? So let's start with Charmaine.
Hey, I'm having like a little bit of a delay, so I'm sorry about that. So I've been with Remend since 2014, and it's just an amazing program. And I just help to coordinate the referrals that come in and help brainstorm a little bit with the webinars and also with our online social community that we just started. That's pretty exciting. Yeah. And I just really believe in the program that we have, because I think that support is just can't have enough support. I also work for Fresenius, and I do insurance. I'm an insurance coordinator with them. So I help dialysis patients and their families with their insurance needs, and also with any financial help that I can offer to them through programs that Fresenius offers.
Awesome. Thank you. Yeah. Thank you for what you do. And Justin, how are you?
I'm well. Yourself?
I'm good. Thank you. Let's hear a little bit more about what you do with Fresenius.
I teach patients how to do dialysis at home, whether it be peritoneal dialysis or home hemodialysis. Once someone starts dialysis and decide they want to do that at home, that's kind of where I step in and teach them how to manage their own care and be their own advocates.
And you've been doing it for quite some time too, so you're a pro at this.
Been doing it for a while, yeah, since the 1900s.
Awesome. Thank you for being here. Cindy, Miss Cindy, how are you today?
Good. Thanks
for being here.
Again. Always happy to join on and help our patients. So, of course, for me, it's empowering our patients and really trying to find opportunities to engage our patients and educate, whether it's their kidney preservation, whether it's helping them understand their diabetes, blood pressure, helping them understand what is CKD, working with the physicians to support them if there is opportunity on modality education. So, so yeah, I guess I'm kind of more of a plug-in educator to really help expand the knowledge of our patients' understanding of their medical needs. So that's what I do.
And one thing, thank you for that, Cindy. I wanted to say that most of the time patients are going to hear the word modalities. And I like to say treatment options. So just letting you know, it's not like you couldn't look it up on the dictionary or anything like that. But we're going to refer to modalities as treatment options. So I'm going to get started here. Thanks for being here, everyone. So the first treatment option that we're going to talk about is transplant. So some people might not think it's a treatment option or look at it that way, but Justin, would you mind letting folks know why we chose transplant as a treatment option?
Well, that's what it is, right? It's not a cure for kidney disease. It's treatment for kidney disease. You still have to manage that modality, as we used as a bad word. It's we have to still take medications. We still have to make conscious health decisions based on that status of having a kidney transplant. So I think that it's exactly what it is. It's a treatment option, and it's the best treatment option, and statistically
right. And we've had so many webinars about it. We can't have enough about that, but we're not going to delve too deep into transplant today, but please do if you would like to learn more about it. And we'll have future webinars about it, but please check out our previous webinars at remen.org, or check us out on our YouTube channel to discuss that or watch the discussion. Also, I've got a couple of myths and misconceptions about dialysis that kind of mixed in here, folks. So Justin, you were just saying, this is a myth. Dialysis is a cure for kidney disease. But in fact, dialysis cannot cure kidney disease. It's a treatment that can partially replace the function of healthy kidneys. So that's important for folks to know that. So home hemodialysis, treatment option number 2, also called HHD. So this is what Justin, his specialty is. We were talking just a few moments ago. What's involved in HHD in setting up and performing hemodialysis at home? What kind of equipment is required, and kind of the overall scene?
So typically we teach patients how to set up a somewhat complicated machine and how to manage their machine and make sure that it's purifying the water properly and mixing the dialysate properly. And oftentimes patients will put a needle in their arm or 2 needles in their arm and monitor their treatment throughout the treatment and record their treatment sessions and monitor their vital signs and order supplies and collect their labs. It's quite involved. There's nothing that's complicated about it or difficult. There's just a lot in order to do home hemodialysis successfully. Mm-hmm. But like kidney transplant, there are the patients that tend to feel the best and live the longest to stay at the hospital tend to do better are HHD patients, transplant patients, and home patients in general.
So how long does it take to perform at-home hemodialysis? How long does each treatment typically last?
So the dialysis industry is largely focused on more frequent dialysis as of the last 5-10 years. And so we do 5 to 6 treatments per week. The sessions could go anywhere from 2 hours and 45 minutes to 3 hours and 45 minutes for the majority of people. Mm-hmm. But it is 5 days a week. But it's on the person's own schedule, right? It's whenever they want to do it. It's not a rigid mm-hmm. time and place to be. It's they might do it at 6 in the morning one day and 4 in the afternoon the next day. The only rule is they don't take the 2 days off back to back. Right? So
I
they can
see.
have 2 days off through the week or 1 day off through the week, but they do 2 days off through the week. The 2 days don't touch each other.
Okay.
I had a
And
question.
Cindy, do you, oh, go ahead.
I was just
Sorry.
curious, and Cindy might, I don't know, either one of you guys might be able to or will answer this, but so is it that you have a port and you access it through a port, or you actually have to stick yourself every time, or your partner or whoever?
So there could be a vascular port that's often put in the chest, and sometimes that can be used for hemodialysis access. It's not as good of an access as one that would require needles to be used. But in the home setting, using the access that is catheter, we'll call it, instead of using needles, the increased chance of infection is decreased as opposed to using the same catheter in a clinic full of, tons of
Well, that's a good point.
humans, which is where the chance of infection is probably the worst. Yeah.
So is it typically, we have a video on that too, by the way, on vascular access. Shout out to Dr. Barron if he's listening or watches this. So where is it typically for HHD? Is it in your arm, or like you said, it was in your chest? I had one in my chest. I know you did too, didn't you, Charmaine?
Yeah, for a short time when
Yeah, me too.
when my shunt wasn't, or my graft wasn't working. Yeah, then I would have the one in my chest. I actually still have the 3 little different spots where I had it.
Yeah, I've got scars all over. Got to remember which one.
Yeah.
But so is it typically in your arm, Justin, or is it? It's up. Is everyone different?
Yes, ideally the vascular access will be in the arm. The vascular access using a catheter in the chest is a hole going from the outside world into the inside of your heart, and of course there's more risks involved with that, as opposed to having our skin as an important barrier to keep the bacteria out, which we get to enjoy with the venous access, or the vascular access being in under the skin, which requires needles.
Yeah, I know that.
Yeah, mostly the access is
in the arm,
involved needles in an arm or leg graft or fistula.
And I hate to keep pushing this, but we have another video about research, and Innovasc was the company that we had interviewed, and they were trying to make it less painful for patients to utilize that as an access for HHD or just, dialysis period. So there's research that's happening to, help patients get through this too. So, all right. Is there anything you want to talk about this, Cindy? What's your experience with HHD and speaking with patients about this?
I think for me, when I'm speaking to patients about it, I go into more of the opportunity for them to have the convenience of doing it at home. I think when I talk to my patients about it, I'm making more of the emotional connection versus the actual physical part of it, because I sense that sometimes they get more engaged and they're more open to starting home hemo at home if they understand they are prepared emotionally for it.
Yeah.
And then once they have that, I guess, affirmation that this is something they can do, then I think the opportunity for them to engage with the actual physical part of it and, take baby steps with it so they don't get overwhelmed with everything that it does involve. But I think the biggest part about home hemo is really the convenience and being at home, being with your family, having the flexibility, maybe doing 2 hours here, 3 hours there, getting up, and then the physician also can help manage a prescription plan for home hemodialysis as well. So not every person's going to be the same. So yeah, I think it's important for them just to get that mindset that they
Yeah.
can do this at home and that they're willing to do this at home. And for them to keep in mind the initial few times of it may not be the most comfortable part of it, but it's just like anything else. You just have to practice and practice and practice and really explaining the transitional care unit that we have to offer for them to get that really good level of comfort before they start actually doing it by themselves.
Right. And we're not trying to sugarcoat it, obviously, that, HHD or dialysis itself is, once you do it, hey, it's fun. It's not that at all. I mean, we just want to
Right.
make sure that people are informed as much as possible because, when Charmaine and I were diagnosed 30 something years ago, we didn't have this kind of information. So I'm hoping that this is helpful to folks that have tuned in or that are watching at some point. So once again, thank you guys for being here. I wanted to talk about the home training center that Fresenius has, because it's a fairly new facility and it's pretty cool. Again, they didn't have something like this previously, but it's a chance for people to actually learn like in person with a team around them, how to use home hemodialysis or in center. So can you tell us a little bit about just kind of what people can experience at the home training center, Justin? Because that's where you're located, right?
I will do my best. That was a little bit choppy, and I hope my internet holds up. But
Oh God, I do too.
typically what we do at the home training center is we have a transitional care unit to where people that are new to dialysis go there to start their dialysis journey, and that's really something we probably should have been doing all along. And it's more of a dialysis school. So you're there with a heavier staff ratio to where we can spend the time to educate all of our new patients that are starting dialysis on all of the different aspects of dialysis, of whether it be lab results or the importance of vaccinations or choosing their modality or their treatment option, to their vascular access, to dietary controls that we should institute, and just the different things that we can really spend the time educating and empowering people that are starting this scary new world of dialysis about.
Well, I love
So
that
we
you
treat-
mentioned dietary, because that is a lovely segue into my next myth. Wait, oops. Stop that share. Hold on. I have done this before. Okay. This myth, patients on dialysis can eat anything they want. No, you cannot do that. Patients who receive dialysis often need to follow a special diet to help control their blood levels of certain nutrients. It's essential to follow the guidelines given by the healthcare team. So it's great that you mentioned that, Justin. I was given a flyer that I hung on my refrigerator back in the
Me
day.
too.
Don't eat things. Bummer, I can't have
little
this.
picture of the egg and the chicken leg.
No pancakes. What? Yeah, that was a big bummer. But now there's so many things. Even if you go to balboacare.com, we have a bunch of recipes on there that we found for you. But there's a lot of good food that people could still have while you're on a renal diet. So I hope that's not. I know it's always a big thing that people bring up when I'm talking to people that are when I'm mentoring people. But you can do it. I mean, if I did it, and Charmaine did it, and we like to eat.
I did it. Yeah.
It's possible. So that was one thing I wanted to share. And then also PD, peritoneal dialysis, treatment option number 3. So clearly Charmaine has experienced
Clearly.
this treatment, and as did I. So do you want to talk a little bit about your experience with that, Charmaine?
Yeah, I would love to. I'm a huge proponent of PD. I've never done home hemo, so I can't speak on that from a personal level, but it sounds like something that would be just as good. But anyway, so I went from in-center to PD, and man, it was just life-changing for me as far as being on dialysis. And, you know, I will be honest and say the first couple of months getting used to the fluid in my stomach and all of that, it was probably the most challenging part, just because, you know, it's a lot of fluid that, and I'm sure that things have changed since then, but I, you know, had to carry around, I think it was like 1.5 liters or something like that, or 2 liters in my stomach all day.
Mhm.
And so that was a little hard to get used to, because it's just like I felt so full all the time. But then, you know, your body adjusts, right? Your body adjusts, and boy, as soon as my body adjusted, I was on the move. Like I was always gone. Like I would
Yeah.
pack the car up and just go on, you know, overnight trips. And you know, I was married at the time, and we used to go up to Willow Springs once a month, and we had like a toy hauler, and boy, I was, you know, like just everything.
Yeah.
Because, you know, I felt like that's what PD was for. It was meant for me to be out and about and trying to live as normal as possible. But the thing
Mhm.
that I wanted to emphasize, and kind of go back to the diet with PD, is that I really felt that, you know, just for myself, I can't speak for everybody, but just for me, you know, my restrictions were lifted a little bit on the dietary restrictions and the fluid restrictions. And so I just felt like my body was getting the nutrients that it needed, you know, to to restore itself and to, you know, heal itself and things like that.
Mhm.
And yes, I did it every day. Yes, every single day. But my kidneys work every day. So why wouldn't I want to have my blood cleaned every day? So that's
Right.
kind of the way I thought about it. And, you know, and so it was an adjustment. It's not like an easy thing, but
Yeah.
I think for me, it was just like night and day for me. It really gave me a lot of my normal life back and
Yep.
what I could do. Yeah.
I'm with you on that. And we'll have Justin and Cindy talk about the actual
Yeah.
process. But I also, you know, was able to travel. I traveled a lot with PD. I
Yeah.
didn't know what it was when I was first diagnosed with kidney disease. And I thought, you know, I was in denial when I was diagnosed, and I thought, oh, everybody has to go on hemodialysis. But then
Right.
someone told me about PD, and I was able to travel to Rome and to Tahiti. It was for work, but not this work. But yeah, it really, you know, it's a lifestyle change having kidney disease, from your diet to, you know, your work and everything in between, you know. So PD was great for me as well. I was able to, you know, order my supplies ahead of time and have them arrive at the destination waiting for me. And
Yep.
it's just all about planning. It's just, you know, change of lifestyle. So, and the diet, yes, was less restrictive of for me. Less than in center, which I went backwards from you. I was on PD, and then I went into in center, which we'll talk about
Okay.
too. But Cindy, I'm
Yeah.
wondering if you, because I know you've talked about this in one of our webinars in the past, can you tell us a little bit about what PD is, what peritoneal dialysis actually is?
Yes. So I've had the opportunity to actually be a part of the procedure and watch a PD catheter being placed. So it is a very small, flexible catheter that is placed in your lower abdomen near your umbilical cord. It's maybe an inch, I would say, the incision, and they have a machine that they come and they guide the catheter and they place it down into the pelvic cavity. The procedure itself is about maybe 45 minutes, but then, you know, there's a little prep time, there's a little post-op time. The patient doesn't feel anything. It's not general anesthesia, it's a local sedation. So in terms of comfort, it's pretty easy, pretty fast. If you're looking to start dialysis quickly because your GFR is maybe under 10 now and you need access right away, PD can happen sometimes faster than a graft or a fistula because the healing time is shorter. The healing time in PD is usually maybe 3 to 6 weeks, depending on the patient. And of course, once your PD is healed, then they have an access to start doing dialysis. So with PD also, you will get some training. You'll have a team of people And the team will be, I believe, a financial counselor, the actual nephrologist, a social worker, and a nurse. And you'll be guided through with your labs every 30 days so that they know that when you're actually doing the dialysis at home while you're sleeping, that it's working effectively and it's doing its job.
Mhm.
So, and that is really guided through and with your labs. That way they can see the numbers of the minerals and actually the toxins and so forth. But the best thing about PD is, like we were saying, the flexibility. You can have a normal life. It's just going to be a new habit that you have to embrace for your bedtime. And, you know, we need to close the door. We need to put the mask on. We need to wash our hands, put the pets out, because you're going to be connecting to a larger machine called a cycler. And there's a little bit of attachments on the cycler with the cartridges and a start button. And I know it sounds so simple as I speak about it, but after a few times and a little bit of training, the simplicity is very appealing. And a lot of patients think sometimes, I don't want to do this anymore. I want to do in-center, or, you know, this is not for me. Then all of a sudden the realization of what maybe in-center is versus PD, then quickly they change their mind back to PD.
Right. And you brought up a great point, and so did Charmaine, that you can switch it up. You can, if
Yep.
you're not digging, you know, in center,
Right.
you might want to try peritoneal dialysis. And you mentioned the cycler. I did the manual version of
Yeah.
it.
Yeah.
And, you know, there's the storage of the supplies because they come in individually wrapped bags. And
Yeah.
I put them all, I had boxes in my closet.
Yes.
And they had
Yep.
different levels or different, what's the word I'm looking for?
Concentration.
Concentrations that you could pull out more or less fluid. It works by osmosis, right? And I'm going to ask you, Justin, to explain it in a technical way, but not that you didn't, Cindy, but but you know, it's weird to have all that fluid in your tummy.
Right.
And then you know, it's like you're draining it out and then you're putting new stuff back in to pull out all the toxins of your body. But it was, like you said, Cindy, it was something that, you know, foreign in the beginning. It was really weird. But after a while, I was doing that, you know, all over the place. I had to do it at my office because I did it like 3 or 4 times a day. And it was nothing but a thing, you know, it's just another thing that I had to get through in the day.
It's just part of your life now. And that's exactly what it is. It's a lifeline. This is your lifeline to keep living. And in terms of the convenience, if this is what's giving you life, it's not that bad.
Mm-hmm. And how long did it take? I can't remember. It was probably what, 30 minutes, maybe, Charmaine, would you say, for an exchange?
Yep.
What do you have to say about all of this, Justin?
PD is an excellent treatment option. I think that if I needed to start dialysis tomorrow, that's probably the option that I would choose. And you guys kind of hit the nail on the head that the bulk of the therapy is done at night while you're sleeping. So it's kind of like a little time machine, right? So you go to sleep, you wake up, and all of a sudden you've got 8-10 hours of your therapy done. You may need to do a little bit more throughout the day, the next day. But the bulk of your therapy is done for the day. So it does free up your schedule quite a bit.
Mm-hmm.
It is a temporary therapy. It's not a permanent lifelong therapy. And I think that gets overlooked a lot. But I think that it's a great bridge to transplant if that's something that's on a person's horizon that they're interested in. And there's, with any of the modality or the treatment options, there's pros and cons.
Mm-hmm.
But peritoneal dialysis is an excellent treatment option.
Well, and one of the things that I hear a lot about, and here's one of the old myths that some people may have heard, but dialysis can cause infections or complications. And that is kind of a reason that so many people that I've chatted with are like, you know, before they've educated themselves about, you know, PD or any type of dialysis, they're concerned about that. But it can cause infections or complications if not done properly, or if patients don't follow instructions given by their healthcare team. The risk can be reduced with the proper care and management and training, also, which you will definitely receive. And you have, a team of people that assist you once you're diagnosed. And who's on that team, Cindy? You have your nephrologist, of course, but is it a social worker?
A social worker, a financial counselor, a nurse. So there's usually like 3 or 4 people there to really guide you and to support your treatment plan to make sure that you're in compliance and that it's working the way it's supposed to be working.
Let's see. Now let's go into the next treatment option, which is in-center hemodialysis. Who wants to start talking a little bit about that? I think that's the OG. That's the version that most people know and expect, right? So who wants to start on that? Jess.
I mean, I can start.
No, go ahead. Go ahead, Charmaine.
In-center was, it sustained my life. I started at a very, very flexible, I'll say, clinic. And so when I first started, I went to Balboa, like the Naval Hospital, because I was military. And so that's where I had my first couple of treatments. And then I transferred over to the clinic that I would be at permanently was being remodeled or rebuilt or something. And so I went to this temporary clinic. And I thought it was just the greatest thing because I would call and say, I'm not coming today. And the nurse would be like, okay, well, just make sure you don't drink that much. And I mean, just like, I'm like, this is great. Like, I can just go whenever I want. Because, I didn't have the education, I didn't understand, like, no, like, you can't do that. So anyway, I learned very, very quickly when I went to the permanent clinic that, no, that is not, no, you can't do that.
Yeah.
So you can't do that. You can't if you miss treatment, you're going to feel it and you're going to really put yourself in danger. And it was just really hard for me. In-center was really hard for me because I was young and boy, I was young and defiant, right? And I didn't understand fully when I first started how that defiance impacted my treatment until I couldn't walk anymore because my phosphorus was so high that it was affecting my bones, that I had restless leg really bad. I had itching, like all this stuff. And it was because of what I was eating, and I was so tired all the time because they would have to pull so much fluid off of me because I wasn't watching what I was drinking, or eating, like the liquids and all that stuff. So it was very, very involved. And looking back on it now, I would say that it probably would have went a lot better had I listened, right? And had I been more open. But again, I was much younger. And, I was trying to just have a normal life. And again, that denial, I think, comes into play where you think that you know it. Right. And I'm here to tell you that you don't. And so that's partly why PD worked better for me because there was less restrictions on that. But for a lot of people, in-center is great. My stepdad did in-center and he thrived on it. So it really just depends on each person.
Right. Right. Thank you for that.
Yeah.
Okay, I'm going to, one of the things that I should have been doing, I've got a poll that I created. So I'm going to launch that right now. I wanted to announce it because I don't know what happens once I do it. So it's a dialysis treatment option. So please, folks, let's see what happens. I launched the poll. Oh, cool. I can see. Can you guys, you can't see that.
I can see it. Yeah.
Really?
Yeah,
we're all learning together, everyone.
Yay.
Yep.
Okay, cool. So we'll see your answers, folks. For those of you that are tuning in, please answer our questions here. They're pretty basic. I only have 3 questions in there. So I'll check back in a moment.
That's awesome.
I know. Let's do it again. I could also copy this one and create a new one during our, but I don't want to disconnect everyone. So, but anyway, we'll check back on that. Very cool. Okay.
Okay, go ahead. Yeah.
Well, let's talk about in-center, Justin. So you train people as well at the home training center for in-center too, right?
Yes, yes, we have people that come to the center to receive their dialysis, and that's where they first initially start their dialysis journey. We had them come in 5 days a week for a minimum of 30 days. And again, we're staffed a little heavier than most clinics, and we have the time to spend with them and talk about their treatment options. But that's unique to the TCU. So the standard in-center hemodialysis clinic in the country, you're going to find is very efficient, and they have a lot of patients coming in, getting the treatment, leaving, coming in, get the treatment, leaving, and that's how the system runs. And that's actually the oldest treatment option as far as broad scale dialysis in the country. And the birthplace of that was in Seattle, Washington, and I can snore anybody to sleep if you need any assistance with that.
Well, give us a little, like a quick review of that, of how it began, what you know about that.
So back in the late 60s, early 70s, people that needed dialysis in order to live would have a home hemodialysis machine. And that was actually the first dialysis machines that I'm aware of that were in use. And those were for patients who had financial means that could afford to buy them because they were quite expensive. And then some people in Seattle, Washington decided that if we just buy a few of these machines and put them in this house, and then people can go to this house and they can take turns using the machines and they can all stay alive. And then that was the birth of in-center hemodialysis. And so that then Richard Nixon actually approved the ESRD benefits package so that the government would help pay for it for patients to help keep people alive that could stay alive with a minimal amount of treatment throughout the week.
Yeah, because the startling fact, before that, people were dying from this, so good thing to know that we do have options now and no reason to skip a treatment because, we're pretty lucky to have this. Unlucky, but lucky at the same time, right?
Right. No,
we're
we're
very
lucky.
fortunate. Very fortunate. And there's countries today that if you have kidney failure, you don't get to go to a center and get dialysis. That's not an option.
Yeah.
So it's not for.
Isn't it, wasn't it like back in the day where the treatments lasted like you were on in-center for all day or something like that? Or am I not remembering?
They were longer, but they weren't, I don't know if they were quite as frequent. I think they would only do them like once or twice a week.
Yeah, that's crazy.
Because the setup for those machines was expensive. I mean, they were using, one, like, if I'm not wrong, like intestines from like pigs and cows, and they would have to sterilize them and use them. And the early ones anyway. But the machines came to be more abundant than we'll sell you this $20,000 machine if you can afford it, and then you can dialyze in your home, and the supplies are expensive, and if you want to dialyze once or twice a week, then that's fine. But fast forward, 60 years, we're finding that the benefits of doing it in your home is great, and we can have as good of outcomes sometimes as kidney transplant patients if we can really follow the guidelines set forth by our care team and do our treatments as prescribed. We really do well with our more frequent home treatments. But I think I went all the way to home treatments when we were talking about.
We're talking about in-center.
Yes. So I've done a lot of education about treatment modalities in my days as a dialysis nurse, and there's good reasons not to do home dialysis, and I respect that. And some of them are that I've heard over the years have been, I like my dialysis at dialysis and my home at home. I don't want those two to mix. Other reasons that I've heard that I really like are these, the other patients and the care team. These are my friends. I like spending time with them. I want to come here. I look forward to it. It's my social outlet. Those are good reasons to go to the clinic.
Yeah. Some
patients want to be more in control of their care and have their autonomy and more control over their schedule. And those are the people that tended to drift towards home therapies.
Cindy, what are some of the things that you talk about when you're educating your patients about in-center?
So in center, I see them qualifying because maybe they're disabled a little bit older, maybe they don't have the functionality of visually seeing certain things or using their fingers and the dexterity of maybe their hands. And I'm also seeing sometimes they're just fearful because they live by themselves and
Yeah.
they're scared that maybe they'll push the wrong button or they'll do the wrong thing or they can't access the site correctly and they don't want to bleed and they're nervous about the needle for home hemo. And those are those are valid concerns. So patients, when they come to me, they've generally had a conversation already with their physician, and the physician's kind of already been engaging this patient to see if they can qualify
Mhm.
possibly for the home hemo or PD or in-center. So certainly we want to give them whatever is best for them, and we certainly want to keep them safe. And, we are err on the side of caution. So if we believe that in-center is the best place for them for treatment, then it's agreed. And then we just do the education for in-center, but it's kind of qualifying the patient a little bit.
So part of that, well, let me ask you this. Can people continue to work and pursue other activities while receiving hemodialysis treatment? And I know, I've experienced it, so I can answer it, but I want to hear what you tell patients.
For in-center, right, you're referring to? Yeah.
Yes.
Oh, yeah. They have a normal life for the most part. They will be more fatigued the next day. Their body's adjusting. So yeah, I have people that I've worked with in the past that have gone to in-center treatments, and there they are back at work again doing their normal jobs every day.
Yeah. Right.
So yeah, you can have a normal life. You just have to be prepared to have that dedicated time to stay in compliance and to get that treatment. And I've seen patients that go, a couple of days or 3 days sometimes without treatment, and now you will end up with complications.
Yeah. Got to follow the rules, guys.
Yeah. Mm-hmm.
If you want to feel better. I mean, for me, I was tired, but sometimes I would go grocery shopping afterwards. Don't overdo it, but and I was, in my 30s when that happened.
Yep.
But yeah, you can still live a normal life, guys. You can still, it's going to be different. It's a lifestyle change, but you've got your diet that you need to consider, and the time, you need to allow the time, because in center it's 3 times a minimum, right? 3 times a week for a couple of hours, 4 hours
3
each
hours,
time.
yeah. But
And
if
they've got
transportation, it's an hour to be there,
transportation.
an hour back. And sometimes, when you're a new patient on dialysis in center, everybody wants to be at the center that's near their house where it's convenient, and the time slot that works for them. But sometimes it's not always like that. Sometimes it's on their on their schedule and their location for their availability. So those are all considerations.
And the timing, though, is pretty open. Like, you have super early in the morning, right? Like 6 a.m. till I think 9 p.m. is when dialysis.
Yeah, there's a clinic in, I think it's like the Mission Gorge Clinic. And when I was there in 2017, they started at, like first shift, and they went all the way to midnight.
That's crazy.
So it was,
but very cool too at the same time.
Yeah.
That they're able to offer that for people's
Yeah.
schedules.
Yeah, it was a lot.
Yeah.
Big clinic.
Looking at our poll here, guys, we didn't have very many people answer, but I'm grateful that they have, because I can tell you one of the questions: when and if you were diagnosed with end-stage renal disease, were you informed about the different dialysis treatment options? 50-50. Some say yes, some say no.
Oh, okay.
The no part really concerns me. I know it's 50-50, but Well, I'm glad you're here learning about those options and continue to learn. Right
That's
on. We're
right.
doing something right then. Okay, number 2, who explained the different dialysis treatment options to you? We've got one person saying the transplant coordinator and another, no one. That must be the no question before. What? Again, if you feel like reaching out to Remend and you need some resources,
Yeah.
I'm going to put them up in a little bit, but that's a bummer. I'm sorry to hear that, but you're doing the right thing by listening today. And the last question I asked, what are some of the factors to consider when making a decision on the type of dialysis option to choose? Quality of life is like 100% of folks. I mean, for sure, right? And travel. Yeah.
Yeah.
And the flexibility and daily schedule. I think we've touched on those.
Yeah.
Right.
I wanted to, if I could, share a little story about my PD. When I started and I was married, and I get this when I talk to people about dialysis and they're concerned about, and the only reason I'm bringing this up is because it has body image on there, and I didn't really care, you know what I mean? But that's just me. I know that a lot of people do care.
Yeah,
but my husband and I named the catheter Captain Winky, and so we just like made him a part of the family. It's just like, when we're like snuggling on the couch, like, oh, watch Captain Winky, like,
awesome.
Because
like Captain Winky,
one little, what is it, about 3 inches protruding from your body. So that's cool. You were able to do that. And then your husband was down to do that, because I was single at the time. And that was tough, but they had these little, they probably have something better now, but I had like a little cotton belt that you could wrap around and put the little, so you could wear a bikini or whatever if you were so bold. But body image is a big thing to consider too about that.
Yeah. But I guess my point is that just to have fun with it. And I was fortunate where my catheter was placed really low. And so I was able to, I just kind of like swirled it around, like taped it, and used the skin tone tape. And I went out to the beach, and I didn't care, but
tip.
but that's something to talk to your doctor about, is placement of the catheter. If you're concerned about body image, see if they can place it lower, or find out where they're going to place it at, because that could make a big
advocate for
difference.
yourself, right?
Exactly. Yep.
Tell them what you want, or if it's possible, find out. It doesn't hurt to ask these types of questions, because better than dreading it and thinking, ugh, why didn't I ask that?
Yeah. And something else to remember, if you're considering peritoneal dialysis, you got to do the due diligence and look online and look at all the articles they have on PD and cardiovascular improvement. That's a big subject. And I saw a bunch of stuff earlier this week too, and because I always check in on PD and cardiovascular, and I've linked into those different segments, but they're finding more and more studies that if you decide to do PD, it's almost preserving your cardiovascular versus in center. So do the studies, do the research, because anytime you get treatment, you want to make sure that, okay, maybe I'm getting radiation, but what's it doing behind this? What's it doing behind the breastbone? What's it doing to my organs?
That's so important.
Do the due diligence, look to see if I'm doing in center, if I have the option of either or. Oh, wow, I didn't know I could actually preserve my heart better, my volume better. I mean, there's a lot of good benefits to PD, especially if you already have a cardiovascular issue or disease. So really do your homework on if you have the option to pick and choose.
Great point. Thank you.
I wanted to share too that I've transplanted twice, and the first time that I transplanted, I was on in center, and after transplant, it was a little it wasn't rough, but I'm just saying, like, it was surgery. So it was just, it was kind of hard to get moving and all that kind of stuff. But, after transplant, I've been doing PD for 4 years. I was like up and like running the halls, like really the same day. Like I was just healthier. I was just in a healthier state
Yeah.
because, again, going back to being able to give my body the nutrients that it needs, being able to drink a little bit more fluid, water that my body needs, right? Because our body needs hydration. It gave me the energy to be more active, and just it's like a domino effect. And so when I went for transplant, I was considerably more healthy than I was after first transplant.
Mhm.
Yeah,
Thank you for
just food
sharing
for
that.
thought. Yeah, you're
Thank
welcome.
you. Hey, I've got another myth that I wanted to share with you. I don't know if you like these better than my true false kind of things.
I like them both.
Okay, good. Myth: dialysis is always painful. Kind of goes in with what we were just talking about. It's not always painful. However, some patients may experience discomfort or cramping during the treatment. Again, you can switch up if something doesn't work for you. I switched up. I was using the cycler, and perhaps my settings, I didn't have them properly set, but I know that I felt a little discomfort, a little cramping. So I went back to PD, a manual. So just, food for thought. Our next treatment option I want to talk about is conservative management, treatment option number 5 for us. So I wanted to talk about that with both of you, Cindy and Justin. Like, Cindy, when someone talks to you, first of all, what is conservative management? What are the different names that people have for conservative management?
That could just be, no dialysis. Like, I don't want dialysis. There's many times patients, we'll talk about dialysis and they don't want dialysis. And do they understand what that means? And that gives me the opportunity to really explore that and make sure that they understand that dialogue, that connection. So, or it can be palliative care. Conservative management just means you have decided that you just want to live without intervention such as dialysis, which is okay. It's a very sensitive conversation because sometimes the patient wants end of life, just naturally no dialysis, but yet the family wants dialysis. The family wants their mom or dad or grandma and grandpa still to hang on to life. So when you don't have everybody wanting the same thing for the family, it's difficult, it's challenging. So maybe I think the best part is to really talk to the whole family about understanding that the quality of life, and this is really that person's decision for conservative management. And it's okay. I mean, 91 years old, and you're lucky to be 91 years old. So, and it's okay to have that decision ready for you to decide that you don't want intervention, you don't want dialysis, and you have to weigh that quality of life at 91 years old. Going to an center most likely and being connected there, and but everybody's different, everybody's health grade is different. It just depends on the individual person. So
everyone has their reasons, their personal reasons. And
absolutely.
Well, what's your experience with this, Justin?
Well, I've been around this field of dialysis a lot, and I think that the most important thing and you touched on it earlier, is all of these treatment options are not permanent. You can change your mind, and I think that palliative care is a totally respectable decision, especially in advanced age. But I think that you should, in my opinion, would be try different things first, because that one you can't change. Once you make that decision, that's a permanent one. So I think that this is often overlooked, that we respect people's decision without giving a little bit more pushback because just try 2 weeks of this therapy. And because like we talked about earlier, there's a lot of rumors that dialysis is this horrible thing to where you feel bad and you're crampy and you're so much pain. And I have people that start on dialysis and they're like, okay, when does the bad part start? It's like, this is it, man. Let's watch your TV and chill out for a few hours and we'll
Right.
this and go about your day. And
Yep.
and that if there's one thing that we could probably be a little stronger on is respect the decision for no treatment, but maybe just pick a therapy and try it for a couple weeks. And then if you don't like it, and then I've had people that are all about doing the dialysis and they're all geared up to do it. And they're like, well, this just isn't going to work for me. So I'm just going to let a natural death occur. And that's fine too, but we made an informed, educated decision. So I would recommend that, especially for this final treatment option.
Thank you. Thank you. That was great. I know it's a tough topic. I have a couple, we're coming around to time here, but I want to just go through this really quick. A myth that I found: dialysis is only for elderly patients. No, the fact is dialysis does not discriminate. It's not just for elderly patients. People of all ages can develop kidney disease and require dialysis. Look at me and Charmaine. You know, we were 30 years old. I was 30. I keep saying you were, but you were
You're
around
still
there.
30, aren't you?
That's right, brother. Thank you.
Yeah, I'll take it, Kiku. Thank you.
So that is a myth. I have some resources here for folks. You know, Reman, our mission is to support people diagnosed with CKD and end-stage renal disease. And we would like to help empower people to make informed decisions about their kidney health, hence the webinars such as this one today. National Kidney Foundation, there are some wonderful people there. I met with a couple of folks. Shout out to Amy. Last week, we got together for an event, but they offer tons of resources and information and different types of dialysis and other kidney-related topics. The American Association of Kidney Patients provides education and support for kidney patients, including information on the different types of dialysis. And then the Renal Support Network. It's a very good organization, offers resources and information on various kidney-related topics. Since we are at time here, I want to go around the room. You guys know I like to do this. You know, please let me know, let everyone know what you'd like people to take away from our discussion today. Cindy.
Well, I mean, it saddens me that there's not more education out there available for people struggling with kidney disease. So if maybe, I don't know, if there was just a way that we could really help guide our patients to navigate more with their care, to really ask questions, teach them the questions to ask when struggling with kidney disease, about the expectations moving forward with kidney disease, what treatment options are available. So, you know, of course, for me, I'm so passionate about education. I would love for these people that don't have education opportunities to understand treatment options to reach out and to your network, to people like us, Reman, and connect back to us. And we would love to help support you.
Awesome. Thank you, Cindy. Charmaine, what are your thoughts?
I just think that it's important, just, you know, reflecting back on my own experience, and Kiku, I know that you shared similar experiences, that just ask, you know, like you said, advocate for yourself. And, you know, Remend is here to help you figure out what questions need to be asked, because sometimes we just don't even know what questions we need to ask or we should ask.
Right.
And just the fact that, you know, you're not alone in your kidney journey. You know, we're here, like Kiku just gave a bunch of, you know, resources, but Remend's here as well. And, you know, we share the journey that you're on. So.
Thank you. I'll put the resources back up while Justin is talking about what he'd like people to take away from our conversation today.
I guess my point would be kind of what we kind of finished with, was consider different options. That's kind of what the key of this chat was about was options. So if you unfortunately have to start a dialysis regimen and it's not working out for you, try a different one. There's at least 2 other options at any given time, if not 3, that you could easily access. And if one's not working for you, then try another one.
Awesome. Thank you. Thank you so much for that. I have the resources here, but I also just want to let you know the next month, please join us for Kidney Conversations with Remen, because we'll be chatting with an incredible human being, Mr. Patrick Wilson. He is a pharmacist, diabetes educator, and health coach. To top that, he's also spent some time working for Fresenius, so get ready for some essential information for effective kidney care management. That's July 20th, y'all. Pharmacy know-how. I may change the name, I don't know. But I want to thank you all for being here. I do have a couple things I want to share. Once again, thank you to our panelists for not only being here, but for the important work that you do for the kidney community. And I hope that the insights shared have proven helpful in guiding your choices for dialysis treatment. And I also want to remind everyone that with the right support and care, life can continue and be fulfilling and enjoyable. Many individuals on dialysis continue to work, travel, and engage in their favorite activities. It's important to maintain a positive outlook and embrace the possibilities that come with each new day. So remember, you're not alone. There's a supportive community of health professionals and loved ones who stand by you and are ready to assist you every step of the way. So thank you so much for watching, and peace out, everyone. Please remember to do the survey questions, and thank you, everyone.
Thank you. Thank you, Kiku. Thank you, ladies.
Thanks, Kiku.
Guys.
Justin, Cindy, see you guys.
Bye.
Bye.
Bye.